All right. So welcome everybody to February 2024's Rehabilitation and Movement Science Grand Rounds. This month we have Dr. Maria DeBlasio with us. Dr. DeBlasio received her bachelor's degree in exercise science from the University of Iowa and her doctor of physical therapy degree from University of Delaware. More recently, she received her certification in lifestyle medicine from Purdue University. Dr. DeBlasio played field hockey for the University of Iowa, and over the course of her career, she has developed a special interest in treating orthopedic and sports injuries. She believes in empowering her patients and providing individualized treatment programs in order to assist her patients in rehabilitating to their previous level of function. She enjoys working as part of a healthcare team and creating a fun atmosphere for her patients and colleagues. As a reminder to everybody, please make sure that you use either the QR code or the login instructions on this title slide, and I've also placed them in the chat for you as well. At the end of the presentation, please make sure that you complete your quiz as well as the course evaluation so you get CE credit or CME credit depending on your profession. A couple housekeeping. This is our activity description and statement of need, and the target audience is all providers. This is our designation statement, and the planners and presenters have nothing to disclose. So without further ado, I will turn it over to Dr. DeBlasio.
Thank you, Steve, and welcome everyone to Grand Rounds. Since you did such a great job introducing me, I'm just going to skip right over this slide and go into the details. Here's our learning objectives for today. The goal here is to provide a general overview of the current state of health in the U.S., as well as a general overview of lifestyle medicine and the 6 pillars that comprise lifestyle medicine. Additionally, to provide some insight into some ways in which we can implement these concepts into our current healthcare practice. So why am I here? Recently, and I'm sure more than just recently, we're seeing an increase in patient referrals like this example, and it's been difficult to determine an effective plan of care. If this looks familiar to you, there's more that will make sense as we're going through this presentation. This patient was a 57-year-old female. The complaint was severe bilateral knee pain. She went to her orthopedic surgeon with St. Luke's, but unfortunately she's not a candidate for surgery due to her medical status. She has a BMI of 55.93, which is in the morbidly obese category. She has prediabetes and she has hypertension, not cleared for surgery. She has had bilateral cortisone injections, which haven't been effective. She doesn't like to exercise, but she's referred to PT. So what can we actually do to help this patient? Can we do some modalities? Can we do an unloading brace? What kind of improvement can we actually provide for her? And are we responsible for fixing her pain? Additionally, if you work in the physical therapy field, what is our photo outcome going to be? Is she actually going to be satisfied with her Press Ganey survey? Those are things we need to consider. So why are we here? What is this concept of lifestyle medicine? Before we talk about what lifestyle medicine actually is, I think it's important to discuss our current state of health in the US and why this branch of medicine was developed. The health and wellness industry is booming. In 2022, the global wellness economy reached 5.6 trillion, nearly 14% higher than in 2019. The wellness economy is projected to continue its robust growth, with the wellness economy reaching 8.5 trillion in 2027. But just because we're investing more money into wellness, are we actually healthier? Are we benefiting from our financial investments into wellness? So let's take a look and see. With all these investments into the health and wellness industry and all of the available nutrition supplements, fitness and diet trends, all of the technological, economic, and medical advances of the millennium, we have to be healthier, right? So let's see, do we eat healthfully? Well, not 77% of us. Do we live active days? 60% of us are sedentary. Are we actually at a healthy weight? 60% of us are overweight or obese. And do we have emotional resilience? We're split at 50-50 here. In the United States, poor diet was once associated with undernutrition. Today is more often associated with excess, particularly excesses in calories, saturated fats, trans fats, added sugars, and sodium. Our unhealthy diet contributes to approximately 678,000 deaths each year in the United States due to nutrition and obesity-related diseases, such as heart disease, cancer, and type 2 diabetes. In the last 30 years, obesity rates have doubled in adults, tripled in children, and quadrupled in adolescents. Nationally, 41.9% of US adults have obesity. At least 35% of adults in 22 US states are now living with obesity, according to the CDC. In 3 of those states, Louisiana, Oklahoma, and West Virginia, at least 40% of the adults there have obesity. By comparison, in 2019, only 19 states had an adult obesity prevalence at or above 35%, and a decade ago, none of the states did. It's a big change. How about diabetes? According to the CDC, 37.3 million people in the US have diabetes type 2. 1 in 10 are diagnosed, but 1 in 5 are undiagnosed. The overall number of Americans with diabetes is expected to rise to more than 54.9 million by 2030. Let's look at heart health. This year, the reports have said that 121.5 million adults in the US, which is 48% based on 2016 figures, have cardiovascular disease. 46% of adults in the US are estimated to have hypertension, and many are not aware their blood pressure is elevated. How about tobacco use? Among people aged 12 or older in 2021, 22% or 61.6 million people reported using tobacco products or vaping products or e-cigarettes. 1 out of every 20 Americans routinely uses a vaping product. It may be a surprise to some that smoking makes your pain feel worse, but in the physical therapy world, we see this all the time. The oxidative stresses increase cellular changes, and it also causes vasoconstriction, which is the narrowing of the blood vessels, which reduces the blood supply, raises inflammatory proteins, and increases our perception of pain. How are we sleeping? Adults need at least 7 hours of sleep each night. 1 in 3, or 33% of adults, do not get enough sleep on a regular basis. It might not seem like a big deal to miss a few hours of shut-eye every other night, but sleeping less than 7 hours a night consistently is linked to a higher risk of conditions like heart disease, stroke, diabetes, obesity, mood disorders, anxiety, depression, and dementia. Studies have found that people who don't get enough sleep are more likely to increase their food consumption. And the type of food we're consuming is high-calorie foods with less nutritional benefit and have a tendency to cause a greater risk of weight gain. Certain hormones are considered to be driving factors behind these poor nutritional choices associated with sleep deprivation. The normal production of leptin and ghrelin, hormones that help control appetite and hunger, are thrown off even after short periods of inadequate sleep. So what is the state of stress in America? About 61% of Americans say their stress level is at an all-time high, with 55% saying they're unable to enjoy their life due to stress. Now, we all know not all stress is bad. An approaching deadline can motivate you to finish a project or accomplish a challenging goal. But negative stress, especially if it is chronic, can cause anxiety and impair your performance, leading to poor mental and physical health. Chronic stress has been shown to raise levels of inflammatory markers in your body, impeding your ability to lose weight and make chronic pain feel worse. If you have a chronic disease or disorder such as arthritis, uncontrolled stress can actually worsen your symptoms and cause more physical discomfort. Extended periods of stress can contribute to a weakened immune system, digestive problems, and high blood pressure, which increases our risk of heart disease and stroke. So how are we doing as a nation with our overall health? Not so good. So in order to examine how healthfully we're living, we also need to look at the causes of our mortality. Let's look at the leading causes of death over the past century and see how they've changed. Over 100 years ago, in 1900, the leading cause of death was infectious disease at 53%. Infectious diseases such as smallpox, cholera, diphtheria, typhoid, and tuberculosis were rampant. Heart disease only accounted for 12% and diabetes for 10%. Cancer 6%. The life expectancy at that time was 47 years. In 2018, and I use this year for a reason, I didn't want to incorporate any of our COVID-19 data, the leading cause of death was heart disease at 33%. Cancer increased to 32%, which is an increase of 26%. Diabetes dropped, and infectious disease dropped to 3%, which is a decrease by 50%. The other category increased to 22%, and that is 8% for frailty and 4% for Alzheimer's, which wasn't included in the 1900 study. The life expectancy in 2018 was 79 years. So what's changed? Advances in medicine, development of vaccinations and antibiotics have changed the leading cause of death from communicable to non-communicable diseases. So let's look at the way we're living then. Lifestyle factors have a big role in contributing to the deaths from chronic illness in the US, and they're preventable and related specifically to how we're choosing to live. Poor lifestyle choices like dietary patterns, physical inactivity, tobacco use, alcohol addiction and dependence, drug addiction and dependence, as well as psychosocial factors such as chronic stress and lack of social support contribute to chronic diseases. In 2024, with all of these advances in medicine and our opportunities to treat disease, what's the big deal? Our expectations are part of the problem. With our current approach to healthcare, we expect medication and/or surgery to fix our issues. There's always something new trending, a newer, better, more effective and convenient health or fitness trend, a new diet, weight loss medication, or a cure for our problems. We expect instant gratification and results with minimal effort. We think there's a quick fix for everything, including our healthcare, fitness, diet, and overall wellness. We rely solely on these external sources to cure our issues instead of reflecting on our habits, choices, and overall lifestyle. Thus, the advent of the term lifestyle-related diseases. 80% of chronic diseases could be prevented with lifestyle factors. 80% of heart disease, stroke, type 2 diabetes, and 40% of cancers could be prevented with lifestyle factors. 80% of healthcare spending is directed toward health conditions related to these lifestyle factors. So what is the cost to us? Healthcare costs related to lifestyle-related diseases account for 70% of the gross national product. The gross national product spent on healthcare in the past decade is 18%. The amount spent on healthcare in 2022 was $4 trillion or approximately $13,000 per person. The projected amount to be spent on healthcare costs in 2031 is $7.2 trillion or an average of $20,000 per person. So why do we care? What is the cost to us globally? Lifestyle-related diseases account for 71% of the global burden of disease. The global burden of disease provides a comprehensive picture of mortality, disability across countries, time, age, and gender. It quantifies health loss from diseases, injuries, and risk factors. The data is utilized to help improve our healthcare systems. So who's to blame for this epidemic of chronic disease? Can we blame our health on bad genes? Genetics is a study of how genes and traits are passed down from one generation to the next. In the current blame game of genetic disorders, genes are credited with disrupting the lives of millions of people around the world. While there are many diseases that are correlated to gene dysfunction, the actual aspect of a defective gene being causative of the disease has never actually been proven. Genes react to the signals from the environment for both proper activity and abnormal responses. It seems that the environment has a crucial role to play in the health of a cell and ultimately the health of an individual. The Human Genome Project is one of the greatest scientific feats in history. This project was one of biological discovery led by an international group of researchers looking to comprehensively study all of the DNA, known as the genome, of a select set of organisms. Launched in October of 1990 and completed in April 2023, the Human Genomes Project signature accomplishment was generating the first sequence of the human genome, which provides fundamental information about the human blueprint, which has since accelerated the study of human biology and improved the practice of medicine. This is nature's complete genetic blueprint for building a human being. Because we now have the human genome, this has created discussions about epigenetics and the epigenetic effects on health outcomes. Epigenetics is a study of how your behaviors and environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence. Gene expression refers to how often or when proteins are created from the instructions within your genes. While genetic changes can alter which protein is made, epigenetic changes affect gene expression to turn genes on and off. Since your environment and behaviors such as diet, exercise can result in epigenetic changes, it is easy to see the connection between your genes and your behaviors and environment. So gene expression determines whether a gene will stay off or turn on. There are two options. Methylation is what we want. It's an addition of a methyl group to the DNA strand. It's the tight packing of the DNA around the spool. Demethylation is when the tension of the DNA around the spool is loosened. We don't want this because this can activate the expression of a gene that we want to keep dormant. So key points: demethylation is when they are turned on. Environment, stress, diet, and lifestyle factors can turn them on, which can contribute to pathological processes. However, their demethylation can be reversed with positive health behaviors and lifestyle changes. So change is needed in how we view our health and the idea of being healthy. We have to shift our focus from treating symptoms to addressing the root cause of disease. We need to decrease our reliance on fixing the problem with medication and surgery and external sources. We need to promote self-responsibility for our own self and our patients. We need to empower and create and support healthful living. We need to be more proactive and less reactive. We need to create a ripple effect of lifestyle habits and choices as our medicine. There's always a place for medicine and surgery, but the goal is to promote preventative care. We have to practice what we are preaching to instill what we are teaching. An ounce of prevention is worth a pound of cure. The power of lifestyle medicine was perceived thousands of years ago by Hippocrates. The antidote for chronic and preventable lifestyle-related diseases is lifestyle medicine. Despite the technological, economic, and medical advances of the new millennium, and to some extent, even because of those advances, the world has experienced a marked increase in chronic illness, chronic disease, including cardiovascular disease, cancer, and diabetes. So if we could give every individual the right amount of nourishment, exercise, not too little and not too much, we would have found the safest way to health. So now that we know the why behind lifestyle medicine, let's talk about what this branch of medicine actually is. It is educating patients on their role in their own health, providing education and support to allow them to replace unhealthy behaviors with health-enhancing behaviors. It is helping those in our community create and sustain healthy behaviors to positively impact their health and overall quality of life. It focuses on educating and motivating patients to improve the quality of their lives by changing personal habits and behaviors. It is evidence-based practice used to treat, reverse, and prevent chronic diseases. Lifestyle medicine is similar to preventive medicine in that it also bridges the gap between conventional medicine and public health. Lifestyle medicine interventions such as behavioral change counseling can be used with adjunct with pharmacotherapy. Like all of medicine, lifestyle medicine promotes healthy lifestyle choices to prevent and treat diseases. Overall wellness and self-management are crucial components of lifestyle medicine and enforce the idea of living healthier through behavioral change. Health promotion is the foundation of lifestyle medicine and encourages individuals to participate in their own care and well-being. In the clinic, major barriers to lifestyle counseling are that we feel ill-prepared and skeptical about patients' receptivity. However, by engaging these patients into more difficult conversations, encouraging healthy decisions, illnesses can be better managed, reversed, or prevented in the long term. So what isn't lifestyle medicine? Is it new? The concepts of healthful living have been around for thousands of years. It is not treating only the symptoms of disease, and it's not being embraced into or integrated into healthcare practice yet. And it's not the first choice to address chronic disease, but it should be. So what's the history of lifestyle medicine? It was founded in 2003. In 2004, the bylaws were drafted. In 2010, the ACLM Fellowship was established, and their seminal article was published in the Journal of American Medical Association titled Physician Competencies for Prescribing Lifestyle Medicine. In 2017, the ACLM partnered to provide lifestyle medicine training for its provider networks. In 2019, the ACLM became an approved provider for the CEs for National Board Health and Wellness Coaching. So where's the evidence? Studies conducted worldwide have consistently shown that key lifestyle choices have a profound impact on health. In Germany, Ford and colleagues estimated that approximately 80% of chronic diseases could be prevented by 4 lifestyle factors in a study in Potsdam, Germany. These factors were never smoking, maintaining a body mass index of lower than 30, being physically active for greater than 3.5 hours per week, and adhering to a healthy diet consisting of high intake of fruits, vegetables, whole grain bread, and low meat consumption. In 2010, in the UK, Havoc and colleagues published a study examining the fact that physical inactivity, smoking, and excess weekly alcohol consumption had an all-cause mortality. They found that the mortality risk of having all 4 poor health behaviors compared to having none was the equivalent to an increase in chronological age of 12 years. They concluded that modest sustained improvements to lifestyle behaviors could have considerable impact at both the individual and population level and were important public health priorities. In 2012, Matheson and colleagues assessed healthy habits in normal weight, overweight, and obese individuals. 4 healthy habits were defined in their study: physical activity, which was defined as engaging in physical activity more than 12 times a month, being a non-smoker, consuming greater than 5 servings of fruit and vegetables a day, and drinking alcohol in moderation. These behaviors resulted cumulatively in a significant decrease in mortality regardless of baseline BMI, with a particular benefit for those in the obese BMI category. So why do we need lifestyle medicine, and what have we learned so far? Lifestyle practices and health habits are among the nation's most important health determinants. Poor lifestyle choices like dietary patterns, physical inactivity, tobacco use, alcohol addiction and dependence, drug addiction and dependence, as well as psychosocial factors such as chronic stress and lack of support continue to contribute to chronic disease. Changing unhealthy behaviors is foundational to medical care, disease prevention, and health promotion. These concepts are super simple and really common sense of medical advice. We inherently know this general advice and routinely mention this to our patients, but is that enough, or is it effective? So here are the 6 pillars: nutrition, exercise, sleep, stress management, positive social connections, and avoidance of risky substances. Food is medicine. The research supports a whole food plant-based nutrition. Eating more unrefined or unprocessed vegetables, leafy greens, fruits, whole grains, legumes, nuts, and seeds has been proven to be the option that's going to provide the most benefit. Leafy greens consist of kale, spinach, Swiss chard, collard greens, and cabbage. Legumes are black beans, kidney beans, pinto beans, garbanzo beans, lima beans, and soybeans. Whole grains consist of quinoa, couscous, brown rice, oats, barley, wild rice, and wheat germ. Nuts examples would be almonds, pistachios, cashews, Brazil nuts, hazelnuts, and walnuts. And seeds that have the most health benefit include chia seeds, flaxseed, hemp seed, pumpkin seed, and sunflower seeds. These are just a few of the examples. There's more, obviously. So what do we want to avoid? We want to avoid sugary drinks like soda, juice, and energy drinks. We want to avoid processed meats, which is sausage, bacon, salami, bologna, deli meat, and processed snacks, crackers, chips, pretzels, things that have lots of ingredients with chemicals and names you can't pronounce. What about exercise? We know that 150 minutes of physical activity each week sounds like a lot, but you don't have to do it all at once. It could be 30 minutes a day, 5 days a week, or broken down into smaller goals. We know that being active can help you improve your health and feel better. It can lower your blood pressure and reduce your risk of chronic diseases. Physical activity can also boost your mood and help sharpen your focus. It can also reduce stress and help you sleep. All of your physical activity adds up. Moving more often throughout the day can help you get enough activity. So the Office of Disease Prevention recommends that we get 150 minutes to 300 minutes of moderate intensity or 75 to 100 minutes of vigorous intensity aerobic activity weekly for ages 18 to 64, and strength training twice a week. So what is moderate intensity activity? It means you're working hard enough to raise your heart rate and break a sweat, walking fast, riding a bike, playing doubles tennis, pushing a lawnmower. Vigorous intensity aerobic activity means you're breathing hard and fast and your heart rate has gone up quite a bit. This means jogging or running, swimming laps, riding a bike faster on hills, playing singles tennis or basketball. Okay, I already went through that. The ODP also recommends doing strength training twice a week. This should be in addition to your aerobic exercise. This could be lifting weights, working with resistant bands, doing body weight resistance exercise such as push-ups or sit-ups, heavy gardening including digging and shoveling, or in some forms of yoga. Activities should work all the major muscle groups of your body: legs, hips, back, chest, abdomen, shoulders, and arms. So let's look at sleep. What are the recommendations here? We know that sleep is important for a variety of functions such as digestion, immunity, healing, and cognition. Many biological processes happen during sleep. Our body temperature, heart rate, and blood pressure dip during the night. Our blood sugar levels regulate. The brain stores new information and gets rid of toxic waste. Nerve cells communicate and reorganize, which supports healthy brain function. Cortisol levels drop, which allows for increased levels of growth and repair hormones. The body repairs cells, restores energy, and releases molecules like hormones and proteins. Much of this repair and growth is in our muscles and bones. So what are the stages of sleep? Rapid eye movement sleep and non-rapid eye movement sleep. During the night, you rotate through 90 to 110 minute cycles of each of these stages. On an ideal night, you cycle through each stage of sleep 4 to 6 times to get a healthy amount of sleep. During deep sleep and REM sleep, the body shifts its resources to the task of repairing tissues and cells. So what are some strategies to help improve quality of sleep? Exercise. Regular exercise can prep your body for a good night's sleep. Experts aren't entirely sure how this works, but it may help you de-stress so your mind winds down, and exercise itself is physically tiring. You want to limit your screen time before bed. The artificial or blue light from phones and laptops decreases melatonin production, which is a chemical that we need to sleep. Your body naturally makes more melatonin in the evening and less during the day, but using devices at night can throw off that process. You want to limit alcohol and caffeine close to bedtime. Both can disrupt your natural sleep phases. Alcohol can impair your ability to enter REM sleep for up to 4 hours after your last drink. You want to skip big meals at night. This can mess with your sleep phases and cause heartburn that keeps you up. You want to make your bedroom cool, dark, and quiet. The ideal temperature for sleeping is around 65 to 68 degrees. Close the blinds and use earplugs or a white noise app on your phone if you're a light sleeper. And you want to be consistent and stick to a schedule. You want to avoid daytime naps, commit to going to bed and waking up around the same time, even on the weekends. This regulates your body's internal clock and makes it easier for you to fall asleep and wake up. Your goal is to aim for 7 to 9 hours of sleep each night, but a minimum of 7. How are we doing with our stress management? What can we do better? Here are some reduction methods. So exercise in almost any form can act as a stress reliever, which we just saw. Being active can boost your feel-good endorphins and distract you from daily worries. Self-care is a critical component in relieving stress and attending to one's overall health needs, whether they are mental or physical. Family members can offer a safe and non-judgmental space to share your thoughts, concerns, and joys. Spending time with a loved one has been shown to decrease your heart rate and blood pressure. Trying different ways, healthy ways to relax, such as listening to music, reading, meditation, mindfulness, or yoga. There are many apps that help provide these services. Here's just a list of the few most popular ones: Personal Zen, Zenvelo, the Mindfulness app, Calm app, and Headspace. How about positive social connections? As humans, we're wired to connect, and this connection affects our health. There is significant evidence that social support and feeling connected can help people maintain a healthy body mass index, control blood sugars, improve cancer survival, decrease cardiovascular mortality, decrease depressive symptoms, mitigate post-traumatic stress disorder symptoms, and improve overall mental health. Counseling patients on increasing social connections, prescribing connection as an exercise, and inquiring about quantity and quality of social interactions at our visits are ways that lifestyle medicine specialists can use connection to help patients to add not only years to their life, but also health and well-being to those years. We also want to avoid risky substances. Use of tobacco and excessive alcohol consumption have been shown to increase the risk of chronic diseases and death. The 2020 to 25 Dietary Guidelines for Americans recommends that adults of legal drinking age can choose not to drink or to drink in moderation by limiting intake to 2 drinks or less in a day for men or 1 drink or less in a day for women on days when alcohol is consumed. As far as smoking cessation goes, the research shows that counseling and medication together in combination are more effective. However, treatments often take time, different approaches, and several attempts. Patience and support are an important part of breaking risky substance habits. So how do we put all this information together and how do we apply it? What are the goals of lifestyle medicine? Lifestyle practices and health habits are we know that lifestyle practices and health habits are among the nation's most important health determinants. And we know that changing unhealthy behaviors is foundational to medical care, disease prevention, and health promotion. We've heard the terms or the phrase, give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. When we do things to patients or passively, we are providing medication, injections, surgery, and again, passive modalities. Doing for a patient, we're educating them, we're empowering them, providing resources and tools to make change. The goal of lifestyle medicine is to create and sustain healthy behaviors that improve our overall wellness and quality of life. We do this by providing education, motivation, support through change, and follow through with our patients. We assist them in replacing their unhealthy behaviors with health-enhancing behaviors. We address the root cause of lifestyle-related diseases instead of chasing symptoms. We want to promote healthy behaviors as foundational to their overall wellness. We want to promote a coordinated team-based approach to healthcare involving other providers in other fields to treat the whole patient, not just their knee pain. The first step in becoming effective in lifestyle medicine is to ensure we have established a good rapport with our patients and gain their confidence in us, and most importantly, their trust. The physicians or clinicians' trust and relationship with the patient, with the support of their family, an interdisciplinary team, and the community is key to improving health behaviors and outcomes. So how do we do this? Through assessment. So we have our social, psychological, and biological predispositions of a patient's behaviors. We want to look at a patient's readiness, patient and their family's readiness, their willingness and ability to make health behavior changes. We want to do our physical exam and see what other limitations they have and what can we address, give them some immediate benefits. We want to look at the lifestyle vital signs. We want to look at deeper questions about their diet, physical activity or inactivity, their BMI, their stress levels, their quality and quantity of sleep, their emotional well-being, and their use of risky substances. In order to understand where our patients are in their readiness for change, we need to actively listen to what they are telling us. We need to engage these patients in deeper conversations about their health and wellness goals and provide education and coaching to assist in a more comprehensive plan of care. We need to assess their lifestyle factors and look at their desire and readiness for making a positive change. So in order to be effective in helping our patients, we need to meet them where they're currently at. But how do we know if we're ready for change? How can we determine if they're at a point of wanting to make a change? So we have to actively listen to their self-talk and listen for key words. We need to try and determine which stage of change they're actually in. In the trans-theoretical model of change, there are 6 stages. In the pre-contemplation stage, patients do not intend to take action in the foreseeable future, which is defined as the next 6 months. These patients are unaware that their behavior is problematic or is producing negative consequences. They often underestimate the pros of changing their behavior. They place too much emphasis on the cons of changing behavior. Examples would be a patient saying, "I don't think I could do that. I don't want to be told what to do regarding my health. I haven't experienced any serious consequences yet as a result of my choices. I don't really see any benefit to making a change." In the contemplation stage, patients are intending to start the healthy behavior in the foreseeable future, which is defined as the next 6 months. They recognize that their behavior may be problematic. They're having more thoughtful and practical consideration of the pros and cons of changing the behavior. And even with this recognition, people still may feel ambivalent toward changing their behavior. Examples of their self-talk would be, "I see how my lack of exercise can cause an issue. I'm noticing some of my friends are exercising and they seem healthier and happier. I think I might feel a little bit better if I start to exercise." In the preparation or determination phase, patients are ready to take action within the next 30 days. They're ready to start to take small steps toward the behavior change, and they believe changing their behavior can actually lead to a healthier life. Examples of their self-talk include, "I'm planning to start an exercise program. I'm looking into a yoga class that I think will work for me. I believe that if I join this class, it'll be a good choice for me and my health." In the action phase, patients have recently changed their behavior within the last 6 months. They intend to keep moving forward with that behavior change. They may exhibit this by modifying their problem behavior or acquiring new healthy behaviors. In this case, they may say, "I am connecting with others in my class and I'm building a new network of some friends. I'm rewarding myself for going to yoga class 3 times a week by going out with friends for dinner. I'm asking others for what their thoughts are on what I can continue to do to improve my health." In the maintenance phase, patients have sustained their behavior change for a while, which is defined as more than 6 months, and they intend to maintain the behavior change going forward. They are working to prevent a relapse into earlier stages. They might say things like, I'm going to continue to do this class. I'm now signed up for a marathon. I'm grateful for making this change. I feel so much better and healthier, and I'm sleeping better. I feel stronger. The termination phase is when a patient has reached a level of not having the desire to return to their unhealthy behavior and are sure that they will not relapse. Since this is not always often reached, people tend to stay in the maintenance stage most often, and that is considered in health promotion programs. So once we figure out where a patient is, what do we do with that? And how can we help them? Motivational interviewing is a technique that has been specifically developed to help motivate ambivalent patients to change their behavior. The key points of this or processes of this is we need to express empathy. Acceptance facilitates change. When we express acceptance, we don't necessarily express agreement. Skillful reflective listening is fundamental. We need to be accepting of their ambivalence and respectful of where they are at. It is normal for a patient to feel ambivalent. People are very attached to their habits and behaviors. We also need to develop discrepancy. Awareness of consequences is important. We need to elicit the patient's concerns. Discrepancy between behaviors and goals motivates change. We can ask questions to patients such as, what's good about this behavior? What's not so good? We want to have the patient present reasons that they want to change or why they should change. They need to hear themselves voice these reasons. The ideas have to come from them. We want to avoid argument. Resistance is a signal to change strategies. If you meet resistance or notice an argument beginning, you may have misunderstood their readiness to change or another issue. Labeling is unnecessary. Non-compliance should be barred from your mental vocabulary. Arguing is counterproductive. Confrontation does not motivate people. Patients' attitudes are sharpened by their words, shaped by their words, not yours. If you meet resistance, you want to roll with it. Use momentum to your advantage and shift perceptions. Meet their resistance with reflection. It sounds like I'm not understanding everything about this issue. This is really important to you. You can invite new perspectives. Do not impose them. Emphasize choice and control. It's your choice. You have control over this decision. Patients are a valuable resource for finding solutions to their own problems. We also want to support self-efficacy and responsibility. The belief that change is possible is an important motivator. Readiness and self-efficacy are the best predictors of success, even stronger than social support. The patient is responsible for choosing and carrying out their own actions and decisions to make change. Hope lies in the range of alternative approaches available. Successful changers use a wide variety of behavioral techniques. So more about what questions we ask and what does that look like. So some key points of motivational interviewing. We want to ask open-ended questions and invite others to tell their own story in their own words without leading them to a specific direction. Open-ended questions are the opposite of closed questions. Closed questions typically elicit a limited response, such as a yes or a no. Some examples of open questions could be, how can I help you with? Can you help me understand your knee pain? How would you like things to be different? What are good things about your current habits and what are the less good things about it? When would you be most likely to want to start exercising? What have you tried before to make a change? And what do you want to do next? Affirmations are statements and gestures that recognize client strengths and acknowledge behaviors that lead in the direction of positive change, no matter how big or small. Affirmations build confidence in one's ability to change. To be effective, affirmations must be genuine and congruent. Examples of affirming responses. I appreciate that you are willing to meet with me today. You handle yourself really well. You've handled yourself really well with that situation, and that's a good suggestion. Reflective listening. is the pathway for engaging others in relationships, building trust, and fostering motivation to change. It includes an interest in what the person has to say and respect for the person's inner thoughts. Some people find it helpful to use some standard phrases. So you feel that exercise might be beneficial. It sounds like you're ready to start working on smoking cessation. You're wondering if going to the gym would be better than working out at home because you'll have some more accountability. The next thing we want to do is summarize. Summarizing is an application of reflective listening. It can be used throughout a conversation, but it's particularly helpful at transition points. For example, after the patient has spoken about a particular topic, has recounted a personal experience, or when the encounter is nearing an end. Summarizing helps ensure that there's a clear communication between the speaker and the listener. It can provide a stepping stone towards change. And then planning. Depending on the response of the client to your summary statement, it may naturally lead into planning or taking concrete steps towards the change goal. So what kind of goals do we want to set, and how can we help our patient? They definitely need to be clear to make a change. SMART goals can be a powerful motivator, giving individuals a clear sense of purpose and direction. By having a specific goal in mind, individuals can feel a sense of accomplishment when they make progress towards that goal, which can be another powerful source and generator of motivation. So specific goals, questions that would need to be answered are, what are you going to do to address the problem? Measurable, how much time will you need to devote to these activities? Attainable, do you have what it takes to follow through? Realistic, what can you actually do? Focus on improvement over perfection. It's progress, steps towards reaching the goal. It's not immediate. And time connected, how frequently will you work on your goals, and how long will you commit to the process? So what are the overall benefits of helping patients make changes in their life? From everything we've learned so far, we know that the benefits of lifestyle medicine help patients live longer in better health with less risk of disease or disability. It's adding years to their life and life to their years. Health is an investment. It is not an expense. It is investment of time into education, understanding, commitment, and effort. It's being accountable for your own health, and your state of health will become an expense to you if you don't take the time to invest in cultivating it. The other benefits of lifestyle medicine for us as practitioners, it helps us establish a partnership with our patients for life, increasing the value of the services that we provide. Some key points, some takeaways. The concepts of healthful living that constitute the foundational principles of lifestyle medicine, or the 6 pillars, are not new to our understanding of health and wellness. Our current healthcare format focuses on treating the symptoms of disease instead of addressing the root causes. Lifestyle medicine is not being embraced and integrated into our healthcare systems or practices yet. Lifestyle medicine is not the first choice to address chronic diseases, but it should be. Some things that are coming, you'll see a quiz coming from Steve in a couple minutes after this presentation is concluded. You'll also see a survey coming through to try and gain an understanding of anyone's interest in further learning more about the concepts of lifestyle medicine and some of the tools and skills needed to implement this in our daily practice. This could be delivered through a Lunch and Learn series and the development of a lifestyle medicine program. Does anyone have any questions?
So please feel free to either unmute yourself and speak into your mic or type into the chat.
Would I be able to see that? Okay.
One question I have for you is, what have you found as the hardest sell, the hardest obstacle to overcome to convince a patient who is struggling with a lot of these sleep deprivation stress issues to realize that those are contributing to their problem?
Say that one more time.
What is the biggest obstacle that you have encountered in helping a patient understand that these lifestyle issues are a large contributor to their problem?
So there's multiple factors, and some of them are things I didn't touch on today, but social determinants of health. It's their socioeconomic status, their financial availability, their understanding and their education of health and what causes their current state. Time, having the time to have these conversations. How do we introduce that into our evaluation time and then our follow-up conversations? How do we engage them and address things that are something that we're not necessarily taught to do when we go through physical therapy school of talking about smoking cessation and how do we introduce that? Yes, we tell them it increases oxidative stress, it delays healing, it negatively impacts your overall health and ability to get better, it increases your perception of pain. But how do we address that with them and how do we help them? What kind of tools do we have? Getting a patient to understand that and then be ready. Their fear. A lot of patients have fear of change. Sometimes fear of knowing more. They don't really want to know what smoking could be causing and how it could be affecting them. I'm not sure if I answered that fully, but the biggest thing I think is our time and the tools and the format to address these factors, to understand them and have our patients understand how they relate to their overall outcome, and then giving them the actual resources that they can follow through with. Having them understand that they need to make a change and then following the steps to make that change and how it's going to correlate to an improved outcome.
Thank you. Other questions? Right, if you do have any further questions, please feel free to reach out to Dr. DeBlasio. Thank you very much for this wonderful presentation. And yes.
There you go, references and thank you. Thank you everybody for your time.
Complete the quiz and the course evaluation, and I will see you next month.